During the time of this pandemic, we see just how much more pronounced these disparities are, especially in vulnerable older adult communities.
Across all these communities of color, the infection rates are somewhat higher than for white populations, but what's much, much higher are the mortality rates. And you can come all the way back to lack of basic access to healthcare, but also lack of access to an internet connection that in these days can be the difference between getting any kind of help and not.
My parents tried really hard to give us as stable and normal of a family life as possible. As I got older, I became more aware that my parents actually didn't have a lot saved away, and they hadn't really thought about themselves and what the future might hold for them.
Almost half of older adults 80 and over still carry a mortgage. And when you're talking about those who have retired, who are on fixed income, what does that mean for people? And how difficult is that?
This isn't just an issue that is unique to one community. This is something that I think is a political problem, is a policy problem, is an information problem, but certainly is a really golden opportunity for different communities of color to work together.
We learned things and researched things with our partners around economic security, around access to health care and services, and around digital connectivity.
I have lived on the south side of Chicago in the same house since 1968, and I'm 90 years old. I was losing my home, and I was like 9 months behind.
Mary's story, unfortunately, is very common in the African American community because until we repair the problems of disparities, we'll continue to fall behind the average homeowner. We have this huge problem in the city of Chicago with affordability. When seniors come to the Chicago Urban League for counseling, that's the first thing they say: I don't know how much longer I'm going to be able to stay in my house. Because with my income shrinking, everything is going up, but my income is staying the same. We may be forced to go live with our children.
Many of these families are still owing on a mortgage past their 70s. And so that's a challenge if we want to make sure that there is generational wealth transfer.
It didn't start with our current seniors. It started from seniors before them and before them. There's a history. What we need is to have a real investment in the African American community. We need hospitals and medical centers that really care about the community.
It's so important for all of us to continue to be connected. In the state as a whole, about a third of African American, Black, and Hispanic Latino older adults lack connectivity and broadband access. So when we look at how we can connect with others, older adults are losing that gateway. About 7 million older adults in the state of Illinois are homebound. The issue of telemedicine, staying connected, is more important than ever.
In many of our communities, the digital literacy gap is very, very high. A lot of our families don't have access to the internet, don't have access to the hardware. And so even new innovation in the medical field online has been a challenge for our community as a result of not having access to the internet in significant numbers.
Advancing Justice Chicago is very grateful to AARP for helping lead on this so that we can make sure that the stories of our parents' generation, the stories of our seniors aren't forgotten or ignored.
It's very important that our state legislators understand that as we go through a recovery effort, that they see investing in addressing these inequities as something long-term.
The best way to arm yourself for effective advocacy is to have good facts and data. So armed with this, we expect to be even more effective on the advocacy front. There are all these disparities, but they are things that we can get at if we focus on the right set of policies.